Welcome. Today, we're diving into the world of coronary artery disease, often abbreviated as CAD. This condition is one of the most common heart diseases worldwide and is a leading cause of illness and death. But what exactly is CAD? Why is it so important to understand? In this video, we'll break down what coronary artery disease is, how it affects the body, and the steps doctors take to diagnose it. Whether you're curious about your own health or want to learn more for a loved one, you're in the right place. Let's start by understanding the basics of the heart and its vital role. The heart is a powerful muscle that pumps blood throughout the body, delivering oxygen and nutrients to every organ and tissue. It works tirelessly, beating over 100,000 times a day. The heart itself needs a constant supply of oxygen-rich blood, which is provided by the coronary arteries. These arteries wrap around the heart, ensuring it gets the fuel it needs to keep working. When these arteries are healthy, blood flows freely. But what happens when there's a problem? That's where coronary artery disease comes in. Coronary artery disease occurs when the coronary arteries become narrowed or blocked. This usually happens because of a buildup of fatty deposits called plaque. Over time, this buildup can restrict blood flow to the heart muscle. When the heart doesn't get enough oxygen, it can lead to chest pain, shortness of breath, or even a heart attack. CAD develops slowly, often over decades, and many people don't notice symptoms until the disease is advanced. Understanding what causes this narrowing is key to prevention and treatment. Plaque is made up of cholesterol, fatty substances, cellular waste, calcium, and fibrin. As these substances accumulate on the artery walls, they form a sticky layer. This process is called atherosclerosis. Over time, the plaque hardens and narrows the arteries, making it harder for blood to flow. Sometimes, the plaque can rupture, leading to the formation of a blood clot. If a clot blocks the artery completely, it can cause a heart attack. This is why understanding plaque is so important in coronary artery disease. Several factors increase the risk of developing coronary artery disease. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, and a family history of heart disease. Age and gender also play a role, with men and older adults being at higher risk. Managing these risk factors through lifestyle changes and, when necessary, medication can significantly reduce the chance of developing CAD. Knowing your risk is the first step toward prevention. Coronary artery disease often develops silently, with no symptoms in the early stages. As the disease progresses, symptoms may appear, especially during physical activity or stress. The most common symptom is chest pain or discomfort, known as angina. Other symptoms include shortness of breath, fatigue, and, in some cases, pain in the neck, jaw, shoulder, or arm. In severe cases, a heart attack may be the first sign of CAD. Recognizing these symptoms early can be life-saving. It's important to note that many people with coronary artery disease don't experience any symptoms until the disease is quite advanced. This is sometimes called silent CAD. People with diabetes, in particular, may not feel typical chest pain due to nerve damage. That's why regular checkups and screening are crucial, especially if you have risk factors. Early detection can help prevent serious complications and improve outcomes. Diagnosing coronary artery disease early is vital because it allows for timely treatment and lifestyle changes that can slow or even stop the progression of the disease. Early diagnosis can prevent heart attacks and other serious complications. Doctors use a variety of tools and tests to detect CAD, each providing different information about the heart's health and function. Let's explore how doctors approach the diagnosis of CAD. The first step in diagnosing coronary artery disease is a thorough medical history. Your doctor will ask about your symptoms, risk factors, family history, and lifestyle. They'll want to know about any chest pain, shortness of breath, or fatigue you've experienced, as well as your diet, exercise habits, and whether you smoke. This information helps guide further testing and gives clues about your overall heart health. After taking your medical history, your doctor will perform a physical examination. They'll check your blood pressure, listen to your heart and lungs, and look for signs of poor blood flow, such as swelling in your legs or abnormal heart sounds. This exam helps identify any immediate concerns and guides the choice of further diagnostic tests. It's a crucial step in the overall assessment of your heart health. Blood tests are often ordered to check for risk factors and complications related to coronary artery disease. These tests can measure cholesterol levels, blood sugar, and markers of inflammation. High cholesterol and blood sugar levels increase the risk of CAD, while certain markers, like C-reactive protein, can indicate inflammation in the arteries. Blood tests provide valuable information for both diagnosis and ongoing management. An electrocardiogram, or ECG, is a simple and painless test that records the electrical activity of your heart. It can detect abnormal rhythms, signs of a previous heart attack, or areas of the heart that aren't getting enough blood. The ECG is often one of the first tests done if CAD is suspected. It provides quick and useful information about your heart's function. A stress test evaluates how your heart performs under physical stress, usually while walking on a treadmill or riding a stationary bike. Sometimes, medication is used to mimic the effects of exercise. During the test, your heart rate, blood pressure, and ECG are monitored. Stress testing can reveal problems with blood flow that might not be apparent at rest, helping to diagnose CAD and assess its severity. An echocardiogram uses ultrasound waves to create images of your heart. This test shows the heart's structure and how well it's pumping blood. It can detect areas of the heart that aren't moving normally due to poor blood supply. Echocardiograms are non-invasive and provide detailed information about heart function, making them a valuable tool in diagnosing CAD. A nuclear stress test involves injecting a small amount of radioactive material into your bloodstream. Special cameras track the flow of this material through your heart, both at rest and during stress. This test provides detailed images that show areas of the heart with poor blood flow or damage. It's especially useful for diagnosing CAD when other tests are inconclusive. CT coronary angiography is a non-invasive imaging test that uses a CT scanner and contrast dye to visualize the coronary arteries. It provides detailed pictures of the arteries, showing any narrowing or blockages. This test is often used when symptoms are unclear or when other tests suggest possible CAD. It's quick, accurate, and helps doctors plan further treatment if needed. Coronary angiography is an invasive test considered the gold standard for diagnosing CAD. A thin tube called a catheter is inserted into a blood vessel, usually in the groin or wrist, and guided to the heart. Contrast dye is injected, and X-ray images are taken to show the inside of the coronary arteries. This test provides precise information about the location and severity of blockages, guiding treatment decisions. In some cases, doctors may use additional tests to assess heart health. These can include cardiac MRI, which provides detailed images of the heart's structure and function, or blood tests for specific cardiac markers. Each test offers unique information, helping doctors get a complete picture of your heart and tailor treatment to your needs. After all the necessary tests, your doctor will interpret the results to determine if you have coronary artery disease, how severe it is, and what treatment is needed. Sometimes, a combination of tests is required to get a clear diagnosis. The results help guide decisions about medication, lifestyle changes, or procedures like angioplasty or surgery. Accurate interpretation is key to effective treatment. Coronary artery disease can range from mild to severe. Mild CAD may only cause minor narrowing of the arteries, while severe CAD can lead to significant blockages and a high risk of heart attack. Doctors use test results to classify the severity and recommend appropriate treatment. Early-stage CAD can often be managed with lifestyle changes and medication, while advanced cases may require procedures to restore blood flow. One of the most serious complications of coronary artery disease is a heart attack. This occurs when a plaque ruptures and a blood clot completely blocks a coronary artery. The affected part of the heart muscle is deprived of oxygen and begins to die. Quick diagnosis and treatment are essential to minimize damage and save lives. Recognizing the signs of a heart attack and seeking immediate help can make all the difference. Angina is a common symptom of coronary artery disease. It's usually described as chest pain or discomfort that occurs when the heart muscle doesn't get enough oxygen-rich blood. Angina can be stable, occurring with exertion and relieved by rest, or unstable, happening unpredictably and lasting longer. Both types are warning signs that the heart isn't getting enough blood and need medical attention. Over time, untreated coronary artery disease can weaken the heart muscle, leading to heart failure. This means the heart can't pump blood effectively to meet the body's needs. Symptoms of heart failure include shortness of breath, swelling in the legs, and fatigue. Early diagnosis and treatment of CAD can help prevent heart failure and improve quality of life. Coronary artery disease can also lead to abnormal heart rhythms, known as arrhythmias. These occur when the heart's electrical system is disrupted, often due to poor blood supply. Arrhythmias can cause palpitations, dizziness, or even sudden cardiac arrest. Diagnosing and treating CAD reduces the risk of dangerous arrhythmias and keeps the heart beating regularly. In rare cases, coronary artery disease can cause sudden cardiac death. This happens when a severe arrhythmia or massive heart attack stops the heart suddenly. While this is uncommon, it highlights the importance of early diagnosis and treatment. Preventing CAD and managing risk factors can save lives and prevent tragic outcomes. If you're diagnosed with coronary artery disease, making healthy lifestyle changes is crucial. This includes eating a balanced diet, exercising regularly, quitting smoking, and managing stress. These changes can slow the progression of CAD, improve symptoms, and reduce the risk of complications. Your doctor will work with you to create a personalized plan that fits your needs and goals. Medications play a key role in managing coronary artery disease. Common drugs include statins to lower cholesterol, beta blockers to reduce heart workload, and antiplatelet agents to prevent blood clots. Your doctor may also prescribe medications to control blood pressure or manage symptoms like angina. Taking medications as prescribed is essential for controlling CAD and preventing complications. In some cases, procedures are needed to restore blood flow in blocked arteries. Angioplasty involves inflating a small balloon inside the artery to open it up, often followed by placing a stent to keep it open. In more severe cases, coronary artery bypass surgery may be performed, creating a new route for blood to reach the heart muscle. These procedures can relieve symptoms and improve quality of life. After diagnosis and treatment, regular monitoring is important to track your progress and catch any new problems early. This may include follow-up visits, repeat tests, and ongoing management of risk factors. Staying in close contact with your healthcare team ensures you get the support and guidance you need to stay healthy. Prevention is always better than cure. You can reduce your risk of coronary artery disease by maintaining a healthy lifestyle, managing blood pressure and cholesterol, avoiding tobacco, and staying physically active. Regular checkups help catch problems early, and your doctor can recommend personalized strategies to keep your heart healthy for years to come. Coronary artery disease can affect women differently than men. Women may experience less typical symptoms, such as fatigue, nausea, or back pain, rather than classic chest pain. This can lead to delays in diagnosis and treatment. It's important for women to be aware of their risk factors and seek medical attention for any unusual symptoms. Early detection is just as crucial for women as it is for men. Older adults are at higher risk for coronary artery disease, and symptoms may be more subtle. Fatigue, confusion, or shortness of breath may be the only signs. Age-related changes in the heart and blood vessels make early diagnosis and management especially important in this group. Regular screening and proactive care can help older adults maintain heart health and independence. People with diabetes are at increased risk for coronary artery disease. High blood sugar damages blood vessels and accelerates plaque buildup. Symptoms may be less noticeable due to nerve damage, making regular checkups and aggressive risk factor management essential. Controlling blood sugar, blood pressure, and cholesterol is especially important for people with diabetes. Smoking is a major risk factor for coronary artery disease. Chemicals in tobacco damage the lining of the arteries, promote plaque buildup, and increase the risk of blood clots. Quitting smoking is one of the most effective ways to reduce your risk of CAD and improve overall heart health. Support and resources are available to help you quit for good. A family history of coronary artery disease increases your own risk, especially if a close relative developed CAD at a young age. Genetics play a role, but lifestyle factors are also important. Knowing your family history can help you and your doctor take proactive steps to prevent or detect CAD early. High blood pressure, or hypertension, puts extra strain on the arteries and accelerates the development of coronary artery disease. Managing blood pressure through diet, exercise, and medication is essential for reducing CAD risk. Regular monitoring helps keep blood pressure in a healthy range and protects your heart. High cholesterol is a major contributor to plaque formation in the arteries. LDL, or bad cholesterol, is especially harmful. Lowering cholesterol through diet, exercise, and medication can slow or reverse the buildup of plaque, reducing the risk of coronary artery disease and its complications. Obesity increases the risk of coronary artery disease by raising blood pressure, cholesterol, and blood sugar levels. Losing even a small amount of weight can have a big impact on heart health. Healthy eating, regular exercise, and support from your healthcare team can help you reach and maintain a healthy weight. A sedentary lifestyle is a significant risk factor for coronary artery disease. Regular physical activity helps control weight, lower blood pressure, and improve cholesterol levels. Even moderate exercise, like brisk walking, can make a big difference. Aim for at least 150 minutes of activity per week for optimal heart health. Chronic stress can contribute to the development of coronary artery disease by raising blood pressure and promoting unhealthy habits like overeating or smoking. Managing stress through relaxation techniques, exercise, and social support can help protect your heart and improve overall well-being. A healthy diet is essential for preventing and managing coronary artery disease. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated fats, trans fats, salt, and added sugars. Eating well supports heart health, lowers cholesterol, and helps maintain a healthy weight. Drinking too much alcohol can raise blood pressure and contribute to weight gain, increasing the risk of coronary artery disease. If you drink, do so in moderation, up to 1 drink per day for women and 2 for men. Talk to your doctor about what's safe for you. Poor sleep quality or sleep disorders like sleep apnea can increase the risk of coronary artery disease. Aim for 7 to 9 hours of sleep per night and seek help if you have trouble sleeping. Good sleep supports heart health and overall well-being. Living with coronary artery disease means making ongoing choices to protect your heart. With the right treatment, lifestyle changes, and support, many people with CAD lead full, active lives. Stay informed, follow your doctor's advice, and take steps every day to care for your heart. Remember, you're not alone. Support is available to help you on your journey. To sum up, coronary artery disease is a common but serious condition that affects the arteries supplying blood to the heart. Early diagnosis and treatment are key to preventing complications like heart attacks and heart failure. By understanding the risk factors, recognizing symptoms, and working with your healthcare team, you can take control of your heart health. Thank you for joining us on this journey to better understand CAD. Stay healthy and take care of your heart.